a lot of times patients have this interesting conception of pain, that pain is just a mechanical focus cause of pain. That means my pain happens because I have a disc herniation, or my pain happens because I have degenerative disc disease. And I compare that to a very old model of thinking that the sun, the moon, Mars, Jupiter revolves around the Earth, right? Back in those days, that's what people believe. We discovered that pain was a little bit more complicated, and that the model of just one specific center of gravity that the whole pain revolves around doesn't make sense. We believe that pain is a little bit more complex, like multimodal. And I give and this is why I tell my patients, a little bit of thought experiment. Imagine if I took a hammer and hit your toe, what would happen? Well, it's going to be painful, right? But the funny thing is, it's still painful after I remove the hammer, after I remove the mechanical cause of your pain. But think for a moment, why is that? If pain was just what you call a mechanical-centric model, hammer caused pain in my toe, then as soon as that hammer is gone, you shouldn't have any more pain, right? But it doesn't work that way. Not with most people. It's going to hurt for days or months, depending on how hard I hit your toe with a hammer. Because something else happens, right? Something we call inflammation, which is a totally different process. It's a chemical process, right? Because the first thing you do if you talk to your family doctor is he'll tell you to ice it and take over-the-counter anti-inflammation. So what makes inflammation so special, at least in our view as pain doctors, is inflammation is a chemical process, and most chemicals tend to be invisible. You're not going to look for it in MRIs, you're not going to look for it in X-rays or CAT scans. And sometimes the way to fix chemicals is to use another chemical. That's why pain doctors would sometimes advise you to get injections. We feel that chemicals can neutralize another chemicals. Now, that's just a small part of the story. Our goal as pain doctors, kind of the meat of the matter, is to give you what I call a diagnosis versus just an opinion. Opinions, and I'll give another analogy. Opinions is like this. You watch the Discovery Channel lately, is opinion, Bigfoot lives in Texas, right? That's an opinion. The diagnosis is when we actually capture Bigfoot with a GPS locator demonstrating it's actually Texas. So what do we do as pain doctors? We try to give you a diagnosis. And that diagnosis can't come from just MRIs and CAT scans, because those are always looking for a mechanical cause. Doesn't mean they're wrong, but it also means that they're missing out on the other possible aspect of pain, which is a chemical process, inflammation. So our goal is to give people the right diagnosis. And the right diagnosis sometimes comes from injections. Getting the right diagnosis means you can get the right treatment.